Good morning, everyone. My name is Chinmay, and I will be the anchor for this webinar. Ma'am, Dr. Sneha, ma'am, will be joining us in a while. And till then, wish you all a very happy World Mental Health Day. And this year's theme for the World Mental Health Day, given by the World Health Organization, is mental health for all, greater investment and greater access. And all of us at Oasis thought of the topic, which is for today, is how to unlock access for mental health is the most suitable. And we have a wonderful speaker who will be joining us in a while. So, Ankit, should we wait for a minute?
Ma'am is joining, so you just continue ahead. Once ma'am joins, so we will continue with the other part.
Okay, yeah,
Yeah.
sure. Okay. So I have been a member at the Oasis organization since past 1 year, and Ankit is actually our senior from the Department of Psychology, University of Pune. And till the time ma'am joins, I would like to invite Ankit to talk a little bit about what we do at Oasis and what Oasis stands for. So, Ankit, over to you. You're on mute, Ankit.
Hello. Yeah, can you hear me?
Yes.
Yeah, sorry for the delay, as in I'm still trying to figure out how to manage both the things, as in this application and everything. So yeah, so about OSS. So OSS is a community. It's a very young community which was started in Iraq, and now currently we have around 60 members from various professions, and they volunteer for the cause or the initiative which they resonate with. Okay, so before OSS, when I was in masters, I was observing, people around me that like everyone is behind the survival. They are on survival mode. They just want to get some job and do something, to earn something. So I was like, I don't know, I was not agreeing with the fact that it's not only about survival, though I'm not saying that seeking survival it's wrong or something like that, but I think for life, there's something more to it. One should always try to find his passion or probably the purpose in his life. So that's why I came up with this thought to start this community wherein we can provide a platform to individuals who can come together and join this initiative, come up with new ideas and explore themselves. Basically, the agenda is to explore themselves, and also while doing this activity, give something back to the society as well. So yes, till now we have done various activities, right from cleanliness drive, then a trekking, leave no trace at Sihagarh route. Then we did counseling, free counseling support to people, who want to share, vent out their feelings, and who needed a little more guidance regarding, the mental health professionals and everything. We did that activity a year back. And we also into like we did this cancer walk also. So whatever comes up in front of us, we always try to support our members and try to execute it together so that everybody can learn and share their ideas together. So this is basically a brief about OSS. People who want to know more about OSS, they can just go on to our website, which is www.reachoasis.org. And to cut it short, like I just want to summarize it, that throughout our journey, we understand, since we are from psychology background, that mental health is the major factor which is correlated with our everyday life experiences, and whatever we do, whatever decisions we make, it affects our mental health as well. So OSS aim is basically to address mental health issues, not only just to spread awareness but to work on ground as well, and also to address problems related to education, and provide platform to individuals who want to explore themselves and find their passion or purpose in life. So that's it. And on the occasion of World Mental Health Day, I thank you everyone for joining this webinar. And thank you, Sneha ma'am. She has joined the meeting. Thank you for accepting our invitation. And I would like Chinmay to continue ahead with the process. Thank you, Chinmay.
Yes, thank you so much, Ankit. So now, before introducing the speaker, I would like to give just a small sort of instruction. I think all of us already are on mute, so let's keep that way. Let's keep our audios and videos on off so that there is no disturbance and the webinar goes on smoothly. And you can type all your questions, all your queries in the chat box, and we'll ensure that all of the questions get answered towards the end of the webinar because the flow will be maintained that way. Now, I would like to introduce our speaker for today, Dr. Sneha Karmani, ma'am. She is a consultant psychiatrist. She has been practicing at Aditya Birla Memorial Hospital, which is at Chisgad, Pune. She has been a senior resident at the National Institute of Mental Health and Neuroscience, which is popularly known as NIMHANS, which is in Bangalore. She has received Best Oral Presentation Award at the 21st International Conference on Frontiers in Yoga Research and its application at Bangalore in 2016. She has also received Best Poster Award at the first symposium on non-invasive brain stimulation in psychiatry in Bangalore in 2016. And this is just a tip of the iceberg, I would say, and there are a lot more things that um, ma'am has achieved and she has been actively participating in. So, without further ado, I would like to invite ma'am to start with the presentation.
Hi, and thank you, Ankit. A very good morning to everybody, and I wish you a happy Mental Health Awareness Week, day, and maybe talk about mental awareness every day of the year and not just today. So I'm going to share my presentation now. Just a second. Mm, just a moment. Huh? Ankit, I don't think it's working the same way that we tried. Just a second. I'll try sharing my entire screen.
Yeah.
First, just a moment. Okay.
Yes, ma'am. Yes, ma'am.
It's showing me only your window that I can share. Just a second. So everybody, sorry, we did a run a couple of minutes back and it was working fine. Something seems to have gone wrong.
No problem.
I'm not able to click on the share window at all. Have you blocked it from your end by any chance?
And just let me check, ma'am. Just one
Yeah.
minute. No, I don't think so, ma'am.
Just a second, okay? Can everybody see the window, see the screen?
Yes, ma'am. It's presenting.
Okay, so sorry for that delay.
Hold on. Just sorry to interrupt you, ma'am. Abhi tak screen, it's still processing, I guess.
Just a second.
Like others are able to view it or not? Like people, can you just confirm?
Yeah,
Like, are you able to watch
So
it?
it's lagging a little bit. Maybe we can wait for a few seconds.
Okay.
Ankit, you have the presentation. Do you want to share it from your end? Maybe I can just talk and.
Okay, okay, sure, ma'am. Just send the presentation. I'll put it from my side.
I have sent it to you a couple of minutes back. If it's there, is it there on your screen yet? Hello?
2 minutes, ma'am. I was just checking your email.
Yeah. The PPT is not yet there on your screens, right?
Yes, ma'am. It's not on the screen.
Okay, okay. All right. Ankit, it's in your mail.
Yes, ma'am. I've received the mail. I'll just share the slide
Yeah.
just in 5 seconds. Yeah.
Yes, yes.
Okay. Is it visible to all of you? Can you see the slide?
Yes.
Yes, I can. Yeah.
Okay. Okay.
Yes, thank you. I'm going to keep saying next when I want to go to next. Okay.
Yes. Yes, ma'am.
Yeah. So I just tweaked the title a little bit because Ankit, I can see my own video. Just a second. Yeah. Ankit wanted me to talk more about the legislation, the facilities, and the Mental Health Care Act. So I'm going to talk about what mental health care is, how do we define it legally, and what are the avenues that you can look out to seeking mental health care. We will also talk about some social welfare schemes and benefits the mentally ill can avail for themselves. Am I audible to everybody clearly?
Yes, ma'am.
Yeah, thank you. Can we go to the next slide? Yeah, so I just said what are we going to talk about in the coming slides. Next. Yeah. Next slide. Yeah. So the Mental Health Care Act, this sort of revolutionized mental health care, and it was passed in 2017. There were a lot of controversies regarding this act, and I will talk about it in the last slide. So basically, it's an act that provides for mental health care and services for persons with mental illness. It also talks about protecting, promoting, and fulfilling the rights of persons with mental illness during delivery of mental health care and services and the related matters. Next. So, what is mental health care? It includes analysis, diagnosis of a person's mental condition, treatment of the condition, as well as care and rehabilitation for his diagnosed or suspected mental illness. Next. So, as for the act, you cannot use your own criteria. It has to be determined in accordance with nationally or internationally accepted medical standards. So, mental illness can be defined based on the International Classification of Diseases by the WHO, or there are other standard criteria which are used in other countries, like the Diagnostic and Statistical Manual (DSM) that is used in the US. So, mental illness means a substantial disorder of thinking, mood, perception, orientation, or memory that grossly impairs judgment, behavior, capacity to recognize reality, or ability to meet the ordinary demands of life. Mental conditions associated with the abuse of alcohol and drugs, but does not include mental retardation, which is a condition of arrested or incomplete development of mind or a person, especially characterized by subnormality of intelligence. Next. Excuse me. So, mental health professional, who are mental health professionals? Many times people don't know. So, it's either a psychiatrist, and the Act in certain sections has a proper definition for a psychiatrist, a professional registered with the concerned state authority. And these registered professionals include mental health nurses, psychiatric social workers, clinical psychologists, and psychiatrists. They include other professionals like people from Ayurveda, homeopathy, Unani, or Siddha who have a postgraduate degree in psychiatry. So, Ayurveda has a Manovignan, homeopathy has something, Unani has something, and in Siddha, I think it's called Nafsiyat. So, these people are also recognized as mental health professionals. Next slide. So the Act defines psychiatrist as somebody having a postgraduate degree or diploma in psychiatry after their medical education, and the degree should be awarded by a university which is recognized by the UGC or by the National Board of Examinations, New Delhi. It also defines clinical psychologist as somebody having a recognized qualification in clinical psychology. Okay. Yeah. So anybody interested can actually ask for the slides. I have just put the definitions as it is. Next slide. It defines psychiatric social worker. It also defines a mental health nurse. So these are mental health professionals. Next slide. What is a mental health establishment? Sorry for the small font. So basically it is any health establishment. It could be Ayurveda, yoga, naturopathy, Unani, Siddha, homeopathy. By whatever name, it is either wholly or partly meant for care of persons with mental illness. It is established, owned, controlled, or maintained by the appropriate government, local authority, trust. It could be private or public. It could be a cooperative society, organization, any entity or person where person with mental illness are admitted and reside at or kept in for care, treatment, convalescence, rehabilitation, either temporarily or otherwise, and it includes general hospital or general nursing homes also, which cater to needs of mentally ill. Okay. So suppose if any of you wants to start a rehab center, maybe a psychologist wants to really look at aftercare and rehab of persons, you have to be registered as a mental health establishment with the appropriate government authority. Without having a proper license, you cannot run even a simple rehab center or a daycare. Going to next slide. The Act, it sort of rests a lot of responsibility on the individual. So the model is pretty much Western. It says that every person shall be deemed to have capacity to make decisions. So even if this person has a mental illness, you deem that they have the capacity to make decision regarding their own mental health care or treatment. If they have the ability to understand the information that is relevant to take a decision on the treatment or admission or personal assistance, or they can appreciate any reasonably foreseeable consequence of a decision or lack of decision on the treatment or admission or personal assistance, or they can communicate their decisions by any means. Okay, so basically they are deemed to be in a capacity to make decisions unless proven otherwise. A lot of times there is a prejudice that a mentally ill cannot make decision for themselves, while that is not the case as per this Act. Going to next slide. It also says that one can make an advance directive. So for example, I may develop a mental illness at some point of time, and I can just say that when I have mental illness, don't give me ECT, don't admit me to the hospital, I should not receive injectable drugs. So I can make advance directives, like you are directing somebody to do something in advance. Okay. And it can be made by a person irrespective of his past mental illness or treatment. Say for example, I've had an episode of depression or psychosis in the past, I can still go ahead and make an advance directive. Okay. And this person who makes the directive should be in a capacity to make sound decisions. And advance directive, I think it's on the next slide. Can you just go to the next slide? Yeah, so the Central Mental Health Authority describes the manner in which an advance directive can be made. Also, the authority will make an online register. So any person can write on a blank paper and they can convey it to any mental health professional regarding their advance directives. And these directives have to be maintained in an online register by the health authorities. And these directives can be revoked, amended, or cancelled at any time, but they do not apply to emergency treatment. That is one good thing. Say somebody is suicidal or somebody is homicidal or violent or creating a ruckus. You can just ignore the advance directive and do what is best suited for the patient and everybody around them in that situation. Okay. And it is the duty of every mental health professional to follow the advance directive. When a patient comes to you, you should know whether they have an advance directive or not. So it should be in keeping with the treatment line. Your treatment should be in keeping with the advance directive, I mean. So the board, there is a certain mental health board that the authorities are supposed to constitute. So this board would constitute people from the government, a lawyer, people with mental illness, caregivers of persons with mental illness, mental health professionals. So you can actually, appeal to this board if you want somebody to modify their advance directive, or if somebody is not willing to take treatment and the consequences can be dire, you can always appeal to this board and the board can review this. Next. Nominated representative, I didn't put much details. This is from the previous act. So if I can just appoint somebody as my nominated representative, I can say that XYZ can take decisions on my behalf if I'm not in a position to take my own decisions. Next. Next slide. Yeah. So right to access mental health care, the act says that everybody has an access to mental health care. Yes. And it is the duty of the government to provide this mental health care at affordable cost, of good quality, in sufficient quantity, with good geographical availability, without discrimination on basis of gender, sex, sexual orientation, religion, culture, caste, social or political beliefs, etc. Okay, next. So this is the heart of the act, I believe. It talks about rights of persons with mental illness. So it says that everybody with a mental illness has right to community living, right to protection from cruel, inhuman, degrading treatment, which we often see in the society, right to equality, right to non-discrimination, right to information, confidentiality. There is a restriction on release of information in respect of mental illness. For example, any professional cannot release information regarding somebody's mental illness in the media or any other form. That is prohibited under this act. Like Sushant Singh Rajput's case, I think if you're aware, the therapist came out and said that he had bipolar disorder. She was not supposed to do it on media. She could have maybe done it when summoned. She could have done it to the police or the agencies, but that is actually prohibited under this act. A person has a right to access his or her own medical records. They have a right to legal aid, and it is the government's responsibility to provide legal aid, right to make complaints about deficiencies in provisions of services. Next. So it is the government's duty to promote mental health and to arrange preventive programs to create awareness about mental health and illness, and also attempt to reduce stigma associated with mental illness. So it involves the HRD department and other departments in training and maintaining care of the mentally ill. Next. Under the act, it says that central mental authority has to be established at a central level, and a state mental health authority has to be established at a state level. And there is also a mental health review board that I just spoke about. And these health authorities constitute people from the government, mental health professionals, ordinary people, caregivers of mental illness, people with mental illness, what I just spoke about, it's the same. Next. So under this act, a person can independently go and get admitted in mental health establishments. Say XYZ has a mental illness and walks into a hospital and says, I want to get admitted. What will happen in India? They'll say, no, who is there with you? Who's going to stay with you? Who's going to sign for you? Who's going to give you a guarantee? So it just leaves all this aside. If I have a mental illness, I can just walk into a hospital or walk into a rehab and say, I need to get admitted, and nobody can tell me that you're alone, you cannot get admitted. Also, it talks of least use of restraints and seclusion. They should be used only when other means have failed to control the patient might harm himself or others, and they should be used for a minimum period of time. Otherwise, what you commonly see in mental hospitals is people are chained, or they are tied to the bed, or they are secluded in a room. All that is prohibited under this act. Next. It also prohibits ECT with it says that we have to use modified ECT, which is with the use of anesthesia. So it does not look as scary as it looks in the movies where they give unmodified ECT. So modified ECT is where we give muscle relaxants, we give anesthesia, and it's a very sophisticated technique, and it's a very good technique, emergency treatment for persons with depression, for persons in whom emergency treatment is needed. It's a very good technique, but it prohibits use of ECT for minors. Okay, and it also prohibits on sterilization of men or women, because it has been seen that in earlier rehab centers, people were sterilized for the fear that they might engage in sexual activity and it could lead to untoward outcome. That is strictly prohibited under the Act. And chaining a person in any form is prohibited. So I don't know if you have visited Nimhans. Nimhans has a beautiful British building, and if you go there, you will see that there are these iron rings which are there on the sides. So people used to be tied with chains and fixed on those iron rings, so they could not move from their place. It's a very good historic thing to see. If ever you happen to visit Bangalore, the Department of Psychiatry ground floor has those kind of iron rings still there. Of course, that those practices are no longer done, but that is something that has been done in the past. Next. Yeah. Next.
Sorry for the interruption. I just wanted to see that new entries are coming in. I'm not able to admit them. I'm just checking if some people are waiting.
Yeah.
Sorry, ma'am.
Yeah, that's okay.
Okay. Is it okay if I keep the slide like this so that, if I get notification to add people?
Yeah, not a problem. No problem.
Okay, I'll just keep the slide like this.
Yeah.
You can continue, ma'am.
Yeah. Can you go to next slide? Am I audible? Yeah. Hello?
Yes, ma'am. Yes.
Yeah. So there is, the Act also talks about responsibilities of other agencies, like it talks of duty of police officers in respect of persons with mental illness. Say you find a wandering mentally ill person who cannot take care of himself. You can always report to the local police station. It is the duty of the police to take them to the closest government mental health establishment or to report to a magistrate regarding so and so person. If a person is in private residence who is ill-treated or neglected, maybe, and it comes to your notice, you can report it to a magistrate that this is happening and the government will take appropriate care. I had seen a patient who was closed in her room for 14 months. Her nails were like 2 inches long. Her hair were matted and she was disheveled. Her family would just keep her like some animal, even worse actually, in a corner of the house. They would just open the room to give her food. That's it. And this lady was completely not in her senses. She was neglected. She was ill-treated. And some neighbors found out and they complained to the closest police station. And it became a big media hype. And this lady came to us for treatment and she's somewhat better. She had so much gotten used to not moving that she developed contractures of the limbs. She could not move her joints properly. She could not stand properly. And we had to do months and months of physiotherapy to even make her sit comfortably. So this is the kind of neglect that people with mental illness face. Another example I would like to share with you is a team. Some of my senior colleagues had visited a village for some camp, and they got to know about a person who has been tied to a tree and who is just given food. So the person, as the tree grew, the rope also became more and more smaller, and this person was just given food. He was just wearing a cloth around his waist, and he was so bad. The hospital people, like my colleagues, they removed the rope and everything, and they brought him there. And he had developed like very bad marks on his limbs where he was tied. And Again, he was also very much not oriented to the society. I wouldn't say he was disoriented in time, like he couldn't tell morning, evening, afternoon, but so much damage had been done to him over the years. Like for years, he was tied to this particular tree. So this is the kind of neglect that people with mental illness can face. That's why it makes provision. It involves the police and the magistrate in this. Next. So it also says that the Act must provide information about insurance coverage. So sadly, that has not been able to happen successfully. So it says that the insurance companies should provide all facilities for persons with mental illness on the same basis as it is available for physical illness. That doesn't happen, because often I see referrals sent to me by other physicians, and at times they would say, "Madam, please don't write that you're a psychiatrist, otherwise his claim might get rejected." So there are many policies which exclude mental illness. So if they have any mental health issues during their admission for any other cause, certain insurance policies will just straight away refuse your claim. There were just one or two insurance companies. One was Bajaj Allianz and HDFC Ergo Plus. These were the two plans. Bajaj Allianz, I don't remember the exact plan, but it has one scheme. These cover mental illness. But I was just going through the Economic Times, and it said that the IRDAI has been given a cutoff of 1st October this year, 2020, where most insurance companies are expected to include mental illness. It should not be an exclusion criteria for insurance. And so that when people are admitted for mental illness, they get a cover, they get a claim. Okay. So mental health care insists that people are treated and cared for in their own community. Mental health care facilities should be available closer to the family, and people should not be confined to these facilities. This enables people with mental illness to live with their families. Okay. And it also focuses on community-based rehab and aims for social inclusion of these persons. Next. So this was something that Modi ji put on the website, advertising about the act. It says that it's just the highlight of the entire act that I spoke about. Next. So what are the challenges in implementation? See, it is heavily influenced by the Western model of legislation. Okay. It is based on individual rights. It is patient-centric. It gives individual total autonomy over them. Like when you want, you go get admitted. When you want, you get discharged. You can write an advance directive. So this comes in way of treatment unless the patient gives informed consent. So in India, the family is a key resource in care of persons with mental illness. And this act just completely does not acknowledge or foster the contribution of family members' support and will in providing care. And also there are acute shortages and irregular distribution of the mental health professionals. There is not enough funds in implementation of the act. Like if you ask me, the state mental health authority is still not in full force. So some of my colleagues were recently looking for getting registration for a mental health establishment, and the state mental health authority is still not working in full function. So it's been 3 years now since the act, actually 3.5. So that's the problem. Next slide. I think this is what talks about the title of my presentation. I think a lot of people would want to know where to go, what to do when you have you're facing with a mental illness or a mental health related issue. So most people who are available in clinics are psychiatrists or clinical psychologists. Often you will see clinical psychologists working together with psychiatrists, or they may have their own independent counseling services. So basically, whenever you go to a psychiatrist or a clinical psychologist, they will talk to you. They will try to understand your problem. They will try to assess you, and based on standard criteria, they are expected to diagnose you. So psychiatrists will diagnose if you have a mental disorder and provide treatment for same. So the treatment for psychiatric disorders is pharmacotherapy and psychotherapy. Many psychiatrists rely heavily on medication. Also, people don't go to a psychiatrist until they are really, really ill. So, pharmacotherapy provides relatively quicker and earlier relief compared to psychotherapy. Also, many cases require pharmacotherapy and may not be treated with just psychotherapy. Then there are few illnesses which respond to a combination of both pharmacotherapy and psychotherapy. Now, what does a clinical psychologist do? Like I said, like a psychiatrist, they can also diagnose a mental disorder, but in treatment, they cannot give you medicines. A psychiatrist is somebody who has done their MBBS and then goes to do a 2 or 3 year course in psychiatry, where they see patients for those 3 years and they are trained to treat mental illnesses. So a clinical psychologist studies both normal and abnormal behavior. So they can do psychological assessments like IQ testing, personality tests, assessment of childhood and adult psychiatric disorders. They can offer a neuropsychological assessment for somebody who has cognitive disturbance. They can provide you vocational testing, among many other services. The therapy, CBT or cognitive and behavior therapy, is a very commonly used therapy for anxiety and depression. They can offer mindfulness-based stress reduction, couple and family therapy, lifestyle management, etc. So there are few psychiatrists who offer psychotherapy, but most often they are referred to clinical psychologists because therapy is very time intensive. Yeah. So whenever somebody is dealing with a mental health problem, they could either go to a clinical psychologist or a psychiatrist. As a first aid, there are many helplines available, especially in the COVID. I know at least of a dozen helplines that have come. There are many chatbots available where there is chat-based therapy. There are many people who are offering online consultation services, but because of conflict of interest, I will not take any names. So this is about mental health services. There are two other kinds of mental health professionals: psychiatric social worker and mental health nurse. So why we need mental health nurses? Because nurses have to be sensitized in dealing with persons with mental illness. So if I have a psychiatric hospital and I have a patient who is violent, usually what you see that people are judged, people are mocked, people are ridiculed. But you need empathic understanding and you should be trained and you should know how to deal with these patients. So mental health nurses are people who have a degree in nursing and are specially trained to take care of persons with mental illness. So these are mental health nurses. Other than this, you have psychiatric social workers. In many cases, you need to do a psychosocial assessment, like you need to understand how is the family situation, what kind of community is the patient going back to, are there any major financial stressors, or does the patient not have adequate family support? Maybe he cannot go back to his family and he may have to be placed in rehab. So this kind of outreach and assessment is done by a psychiatric social worker. We have a dearth of all mental health professionals. There are just about 4,000 to 5,000 psychiatrists in India. I don't know the exact number of clinical psychologists, but clinical psychologists, psychiatric social workers, and psychiatric nurses are also really scarce in the country. So, but these are the two people that you can reach out to directly whenever you're facing with a mental health issue. Next slide. So I'm going to talk about social welfare schemes for the disabled. I'll just skim through these slides. It's just for anybody who would like to know if there are any schemes available for people with mental illness. Next. So a society which is good for disabled people is a better society for all. We need to be sensitive and empathic towards these people. So the universal definition and understanding of disability has rightfully moved from merely medical to a human rights perspective. And now it has, from charity, it has moved to a rights-based approach. So when you open a rehab, you're running an NGO, you're not doing any charity. When you are creating awareness among these people, you're not doing any charity. It is their right. Going to next slide. So fundamental objective of these schemes is to promote, protect, and ensure rights of these people. We have to promote respect for their inherent dignity. Persons with mental retardation and mental illness can avail social welfare benefits like any other disability. Next. So these are the four major acts: the RCI, the Mental Health Act, the National Trust Act, and Rights for Persons with Disability. I spoke about the Mental Health Act in detail. Let's talk about a couple of others next. So, Rights for Persons with Disability Act in 2016, the earlier act had only 7 disability conditions covered, but this one has 21 conditions covered. So, if you see number 8 includes mental illness, there are other like autism spectrum disorder, cerebral palsy, all these things are also covered. Learning disability is also covered. Going to next. So they have education benefit. It says that every child has a right to free education, and people with disability have 5% reservation in government educational institutions. Next. And there is upper age relaxation of 5 years for admission in institutions for higher education. Next. They also provide award for meritorious students. Next. A scholarship or stipend may be given if they are persons with mental illness and if they come in the income bracket. Next. There is job reservation, 4% in A and B posts and 5% in C and D category. There is relaxation of upper age for job applications and they provide incentives to these people. Next. And there are facilities for relaxing transfer availability for these people. Next. Next slide. Yeah. There is also IT exemption if they have a mental illness and a disability because of the mental illness. Next. There are many social security benefits like they can avail a loan. I have written the criteria here. Next. They can avail travel concession. Next. They can avail free housing facility under Indira Awas Yojana and there are many other schemes. Next. Yeah. So they can affirmative benefits like they can appoint a guardian for themselves and this is sort of promoted by the law. Next. The National Trust Act was established in 1909 and this also works for persons with mental illness, children with intellectual disability, learning disorders, and these are the number of schemes under this. Next. So Disha is for early intervention, school readiness, it's for children, daycare facilities and education is provided. Vikas is also daycare. Next. Samarth talks about respite home for orphans or abandoned families in crisis, destitute population. Gharanda is a group home for adults where it provides lifelong shelter. Next. Niramaya offers a health insurance. Next. Prerna offers marketing assistance. So it can, it trains people in vocation and it can provide you opportunities and funds to participate in exhibitions, melas, fairs, or to sell their products. Next. Sayogi is a care associates cell where it can create a skilled workforce of care associates to provide adequate training and nurturing care for persons with disabilities and their families. Next. You can offer them aids to help deal with their disability, any devices that they would need. Badhte Kadam is an awareness, community interaction and innovative project. So it increases their representation in remote areas. It spreads awareness about myths, misconceptions about disability. It creates awareness. It sensitizes community towards mental illness. It talks about social integration and mainstreaming of these persons. Next. The government is also expected to provide skill training for women. So vocational training programs are being run. Next. So a sizable number of persons are handicapped because of a physical or mental illness. So Government of India has been providing relief and help, trying to rehabilitate them. So as a mental health professional, we must interview, evaluate and assess residual capabilities and functional skills. Mainly this goes down to psychiatric social workers wherever they are available. And we must train these people to ensure their job adjustment, which is best suited to their own unique strengths and weaknesses. Next. Yeah. So I think my presentation covered a lot of things. Is there anything else the audience was looking for? Anything in particular?
If anyone has any questions about the topics that we have covered, we can open the forum for the questions. You can unmute and ask your questions to ma'am, or also type in the chat box, whatever is visible.
How many psychologists here?
Plenty of them have attended. Like I'm not sure about the number, but
Many psychologists. Like I was just
many.
trying to find out how many people
Yes.
are from the mental health care domain. Yeah.
Yeah, quite a lot actually, ma'am.
Okay. Okay.
Hello,
Yes.
ma'am. I have a question.
Yes.
If there are students who are studying in college or schools, and if they
Yeah.
are going through some mental health issues, and if
Mhm.
they are not capable of visiting a clinical psychologist or a professional,
Yeah.
because if they can't afford, so is there any scheme or any other way for them to get treatment from a mental health professional or any other way?
See, basically, many schools now are appointing counselors, psychologists. So you will see any good school will have a school counselor. And actually, the Ministry of Education has mandated it, but you know how laws and regulations are followed. But I know
Okay.
many schools, in fact, most schools now have a school counselor or a psychologist. So here, the teacher is the first step. So she's your first point of contact who could identify maybe something related to a child's reading or behavior in class, or maybe they're not able to write, or it could be a learning disability, or it could be any behavioral issue. So in the school, the teacher is the first interface. If parents notice anything at home, maybe they can just talk to the teacher, and the teacher can facilitate the child's consultation with the school counselor. Now, the thing is, we don't adequately train the school counselors. It's a sad state that anybody calls themselves a clinical psychologist. I think regular counselors should also be sensitized about clinical psychology, so that they can pick up the illness when there exists one. There are many checklists available, like there is a child behavior checklist, which if you do it, you can actually identify if the child actually has a more serious problem. Sometimes the child might be going through something at home or in his social circle. So the psychologist needs to be sensitive and empathic, which any mental health professional should be actually. If they cannot afford, if they really need intense mental health care, then maybe they can be taken to a government institute where the charges are minimalistic. So, like Sassoon has it, Sassoon Hospital. We have YCM, Yashwantrao Chavan Memorial in Chinchwad. DY Patil is there, even though it's a private institute, it has a good psychiatric setup with minimal charges for patients. So maybe they can avail government facilities for that. And many mental health professionals, not many, but at least a few, are sensitive, and they sort of won't charge somebody who's not affording at all. But it's not an economically viable thing if you start doing it for every client. So I think a better idea would be to refer them to a government setup.
Ma'am, do you know any such institutions in Nasik?
In Nasik, I know of medical colleges in Nasik, but I don't remember the name now. If you want, you can just take my number from Ankit and get in touch with me. I have a few friends and colleagues in Nasik. I can just let you know.
Sure, ma'am.
Yeah.
Thank you.
Hello.
Yes.
Hi. Like, I wanted to ask about, like, I think most of them we talked about the symptoms. I guess mostly it is dealing with emotional quotient, right? Any kind of common self initiatives that can be taken to improve that emotional quotient.
Okay. See, I think emotional quotient is important, but many other quotients are also important, like your social quotient, your IQ, your behavioral quotient. So, emotional quotient, if you have a good emotional quotient, you will be able to handle your stresses very well, which will reflect in your behavior and overall feeling of well-being and functioning. So I think to increase your emotional quotient, it is a lifelong process. There is not one day when you wake up and you say, okay, now my EQ is good. I think it's about self-work that you're talking about. So many people, in fact, a lot of mental health professionals also try to be in therapy just to understand themselves better, to be able to analyze their emotions better, to be able to process them better, to have healthy relationships with themselves and others. So I think you can read stuff on psychology and not just read it, but try to apply the things that you can on yourself. There are many mindfulness based techniques that are available. So if you're mindful, see, the first step is acceptance and insight. So once you know what you are, once you know what you're dealing with, once you know how you are, maybe you can work on yourself from there. So I think maybe practicing mindfulness based techniques, practicing self compassion, compassion for others, these are some very, very general terms. But some people also go for therapy just to kind of, know themselves better, be a better person. Many people seek therapy for these abstract things also. So I don't know if that addresses what you wanted to know.
Yeah, somewhat. Like you said, to read about the stuff on psychology. So, any books that we can look on?
I think Daniel Goleman, Ankit, Daniel Goleman has a few books on EQ, I guess. Yeah.
Yes, ma'am.
Yeah, I read a lot of stuff on self-compassion. I'm currently reading a book. I forgot the name of the author. I'm currently reading by Kristin Neff. Yeah, I'm reading that book. It's a book on self-compassion. I've just read a few pages, like maybe a couple of chapters, and I seem to like it. So I sort of just pick random stuff. I go to the bookstore. I love to surf and pick up something and read. Uh, and maybe when you're seeing clients, going back and reading, if you're in intense therapy, often there are many things you learn from your clients also, because when you go back and read and reflect, sort of that helps. But I think Daniel Goleman has books on EQ. I'm currently reading one on self-compassion by Christine Neff. Brené Brown writes a lot on vulnerability, and I like her work also. But you can just see what you like. I mean, you might like to read one form of one school, you might not like the other. A lot of Buddhist techniques also are based in mindfulness. Even they could help you sort of understand your emotions better and process them better. So it can be very individualized.
Okay, all right. Thanks.
Yeah.
Hello, ma'am. I have a question.
Hello. Yeah.
Hi, ma'am. My name is Kunal, and I wanted to ask is if a person is diagnosed with any kind of uh, psychological or neurological disorder
Yeah.
and is making decisions which are not beneficial for him or people around him.
Yeah.
So, how can we counter that, or how does that stand legally? Can you please explain
Yeah.
a little
See,
bit on that?
first, whether they have an insight or not. Okay. So if they don't have an insight, it becomes a bit more difficult to deal with them, because if you say you're doing a wrong thing, they are not going to agree with you. If you say you have an illness and because of your illness you're doing it, they may not agree with you. Okay. So one is whether there is a nominated representative. So in case of a minor, there has to be a representative, which could be a guardian or a parent, who can make the legal decisions on their behalf. If they are not of a sound state of mind and they are seeking help with a neurologist or a psychiatrist, the psychiatrist can give you a letter. Okay. If the institute is, has any legal aid facilities, like I've worked in institutes which had a legal cell. So, we would see them, we would refer them to the social worker would take them to the legal aid, and then things would go. So we wouldn't see what is being done after we refer. But yes, that can be done. Maybe you can just tell your psychiatrist or neurologist to write it down. You can consult your lawyer. If you cannot afford a lawyer, maybe go to the magistrate and tell them that this is the situation. A nominated representative can be appointed if the person is not in a sound state of mind, and whoever the nominated representative is can make the legal decisions on the patient's behalf. And the patient's decisions will not have any legal implications, because as of that time they are not in a state of mind where they can make sound decisions. So that the path of law can be taken here, but that has to be in association with your mental health professional or the neurologist or whatever.
All right. Thank you so much.
Yeah.
Hello, ma'am.
Yes.
I would like to say that it was a fantastic presentation, very informative for a person like me who is not from a psychology background. And my question to you.
Thank you, Prajakta.
And my question to you is,
yes.
Do you believe that the efforts taken by the executive bodies of the government of India are enough for the dire of the demand in our country?
No, they are not enough. They are not enough. I think there's a huge gap between the care and the need. So MH gap was a term given by the WHO. So that gap is huge in India. The numbers are not even close. So, and I don't think these schemes are effective also because, it gets corrupt at some point from the point of where it is sanctioned to where it has to reach. But yes, at the same time, I believe the government is taking efforts. It is appointing district mental health psychiatrists, and it is paying them well also. It is running a lot of schemes, like if somebody has a mental illness, they can go get a disability certification. They will get a certain amount of money every month. And there are a lot of other benefits also. But we are a huge country. We are a poor country, and we are trying to do what we can. So I don't think the needs are going to be met in the next 10 years also. I don't think that's going to happen anytime soon. But yes, we are striving towards it. And I don't think I'm the right person to speak on the government's behalf. But yeah, I see some efforts. I don't say they are apathetic towards mental health needs of people.
Thank you, ma'am.
Yeah. Yes. Ankit, we can take just one more question because I have patients in the clinic. If there are no questions, then maybe we can just...
Sure, ma'am. Sure, ma'am. So if anyone has any question, please ask your question. I'll just check the chat box. Yeah. So if anyone has, please ask it right now, or you may, contact us so that we can contact ma'am for your, like, whatever questions you have. So we can send it to her. Chinmay?
Yes, so I think we are done with the questions. Yeah.
Yeah.
Okay, yes. Thank you so much, ma'am. It was a very wonderful session, and it was a very new topic for all of us who are already from the psychology background. So it was a very enlightening session. And thank you so much for the guidance. And I hope it helps all the people who have joined this webinar, and it gives them some direction towards working on their mental health. And wishing everyone a very happy World Mental Health Day again. And have a great day, everyone.
Yes.
Thank you so much.
Yeah, thank you, Chinmay. Thank you, Ankit, for the opportunity. And thank you, all the attendees, for patient listening. I can only assume that you were patient since everybody was on mute. So I hope at some level, even if it's a drop in the ocean, we keep talking about mental health awareness. Don't take it when somebody says demeaning things about somebody with mental illness. Support people who are in need for mental health care. And I think the youth is going to make a lot of difference. And I hope to see good changes in mental health care domain. Thank you so much, everybody. Bye.
Thank you so much, ma'am. Have a
Thank you,
great
ma'am.
day.
Bye bye.